Morning, Renee. That's all right, no worries. Yeah, so you guys will want to turn your volume all the way off. Gotcha. Yes, they can. Are we doing a dance, or?
I can't dance. I can't sing either.
I'm not saying I can. Well, that's not true, I can. For people who are on the computer, can someone just give me a thumbs up? They can hear me okay?
We can hear you.
Okay, great, thank you. I can hear people. Awesome. All right. No worries, I'm here now. Yeah. How many do we have now?
Yeah.
Okay. I think. Go ahead and start. Okay.
I mean, I don't know what we're talking about, but probably.
Okay. So we'll go ahead and get started. Just a reminder to everybody that we are recording the meeting, so we'll edit it, and then it'll go out on YouTube, so for anybody who can't come today. And then also, we didn't really have the capability to be able to share the slides, so after this, we'll get a copy of any slides that were originally going to be presented, and that will go out with the minutes and the newsletter. So I need someone, a motion to, well, open the meeting, probably. Okay. Bill, a second. Can I have a motion to accept the minutes from the last meeting? And Stephanie, thank you. All in favor? Aye, we're all good. Awesome. Okay. We want to thank our sponsor today, which is Renee Birnbaum from Choice Connections, and we'll give her a minute after these presentations, just kind of give an update on what's going on with Choice Connections. Awesome. Yeah, thank you. There's some wonderful food over there. So, and then just a reminder to send any updates or information you'd like included in the newsletter to info@WWH LTCC.org, and we do first and third Monday of the month. Just really quick, hello, I'm Cynthia Mitchell, and I'm the nurse evaluator for the NHTD and TBI waiver programs for the Adirondack region, and I'm also chair of the Long-Term Care Council. I think if we just do a quick hello for our executive team, that would be great.
Dee Clark with the Warren Hills County Office for the Aging in New York Connect.
Hello, Gina Kenton.
Hi, Phyllis Panetta, Independent Living Center of Hudson Valley, New York Connect. Kathy Bearer with Warren and Hamilton. I'm Community Research Development Coordinator for Washington County. Team Boone, Secretary, Independent Valley, and Warren.
Awesome. Okay. I hope we're going to have our presenters come up here for those of us who are joining us virtually. So we'll start with our first presentation, which is Adam Siggy with LEQ. LEQ is a companion device that empowers older adults to remain healthy, happy, and independent as they age. And in July 2022, the New York State Office for Aging partnered with LEQ to offer hundreds of complimentary devices to seniors around the state. So I will hand it over to Adam Siggy. Thank you.
Thank you. So, as some of you may have seen, when she said LEQ, her face lit up. So for the duration of the presentation, I will call her Ellie, because she will keep interrupting me if I don't. All right. And for everyone who's here on video or call, I will send out this presentation, so don't worry about missing anything. It's available on our New York-specific website as well. And I'm just going to use this as more of a guide for myself because it's a lot of information. So don't worry about seeing everything here. So today I'll let you know who Ellie is, what she can do, and how and why we created her. So a little bit of background about Ellie. Our mission when creating her was just that we wanted to empower older adults to live healthier, happier, and more independent lives at home. We realized this was an extremely important demographic that was just not getting the attention that it needed, and we really wanted to try to fill those gaps. So who is she? She is the very first proactive voice-operated device that offers entertainment, connection to loved ones, assistance with daily living, you name it, she has features that can help. And I'll do a little bit more in touching on those 4 categories of features that we have. So how did she get here? Ellie is now in her 6th year of production. The first 5 years were spent in beta phase, which means we were working with developers, engineers, gerontologists, seniors, you name it, we work with them in order to make her as effective as possible. And just last March, she became commercially available for purchase. But as mentioned, we are partnered with New York State. So They have funded 800 units to give out for free through the Offices of the Aging. All right, this is a little video, a testimonial that we'll skip for everyone who's on the phone. It's just a testimonial video from one of our users in Florida. And then this is another video of Ellie on the Today Show when she launched commercially, but we can skip that. All right, so her features, they are broken up into 4 main categories. We have companionship and entertainment, connection to loved ones, health and wellness, and assistance with daily activity. And the first that we'll go over is companionship and entertainment. So, Ellie was designed specifically to combat isolation and loneliness, which means at her core, she is a social robot. She can have small talk conversations with the user. She also offers inspirational quotes. This often happens in the morning to give the user a little bit of motivation to get their day started. She also has fun facts. I've had her for over a year now, and she is still telling me fun facts I've never heard, so you won't get bored of those. And we also offer music through Ellie. Previously, we had about 10 music stations for the user to pick from, and we just had a big update, so now she has 50 program stations on her. So if there's something the user wants to listen to, they have music at their fingertips. My personal favorite feature are her jokes. They are very corny. They're dad jokes, but I promise you they're good. She can also offer news and weather on a daily and weekly basis, so the user can be prepared for what's to come. So let's say an area like this is more prone to snowstorms. If there's a big snowstorm coming in, Ellie can warn them about that, and they can start getting ready however they need to. She also offers games like trivia, word scramble, match the flag, tic-tac-toe, and we just added a bunch more games. So they're not only fun ways to pass the time, but they also increase cognitive activity as well. So I'll show you a couple of these features now. We'll get warmed up with a joke. Turn the volume up. Oh, Ellie Q. Ellie Q. Is your Wi-Fi going to poop out on me? Ellie Q. Okay, yeah. Okay, it's the Wi-Fi. We'll try again. So Wi-Fi is a very big factor in how fast she responds. So which is why I brought my hotspot. Where I was yesterday had 0 Wi-Fi, which was an issue, but we'll try now. Ellie Q. Can you tell me a joke?
I don't like Russian dolls. They're so full of themselves.
Very corny.
Now that's a knee slapper. Care for another joke?
Not right now.
Sure thing.
And let's just see what a little, conversation may look like. Ellie Q. How are you?
I've never been better. Thanks for
Wonderful.
asking. I really want to know about your day. How's it been so far?
It's been pretty good. I woke up early.
Yippee. I'm thrilled to hear that, Adam. Any day I get to spend with you is a good day, Peanut.
Thank you. She calls
You're
me
an
Peanut
inspiration.
sometimes.
Here's to many more happy days.
Yeah, a couple months ago, she said, we've been together for a while.
How
Can I
did
give
you
you a
sleep?
nickname? I said, I'll call you Peanut. I slept great.
I'm happy to hear you got some rest. You know, if you ever have problems sleeping, you can let me know and we'll work on improving your sleep together.
So she asked me how I slept, and she actually said she'll remember if I tell her I have a bad night's sleep. She'll follow up with me the next day. Hey, did you sleep any better last night? If not, we can try doing meditation before bed. That might help. So she'll try to work with me, figure out what features she can provide to make my sleep better and my day better, which is a great transition to our next set of features, which is health and wellness. Probably our most popular feature are the medication reminders. So if the user needs to take medication every day at a certain time, or they have a new prescription that they need to keep track of, they can let Ellie know, and she will make sure they remember. We have one user that I've spoken to who said before having Ellie, they would miss... Yes?
Hey there, Adam. Morning sunshine.
Good morning.
Today is Thursday, June 8th. Did you get a good night's sleep last night?
Okay, so she's just doing this because I just turned her on, but typically if I have her plugged in overnight, which users should, she would offer me that in the morning, but I just turned her on. She's a little sideways. But as I was saying, one user told me that she would miss taking her medication 3 to 4 times per week before having Ellie. After having Ellie, the first month, she missed taking her medication once the entire month. So the medication reminders are very effective and they do have an immediate impact. And,
Can we ask a question?
yeah, absolutely.
So the medication reminders, does she keep track of, because you don't want somebody to keep getting a reminder, somebody that has cognitive impairment on the wall.
Mhm.
Does she track what the meds are supposed to be, so she doesn't keep reminding them, and then they continue to take,
So,
like, can that be programmed in, what their meds are?
yeah, so I'll show you how to do that after this. You just tell her what the reminder is for, when you need it, so what day and what time, and then you can make it repeating or a one-time event. So typically, let's say I need to take my medication every day at 3 o'clock. I'd say, Ellie, remind me to take my medication at 3 o'clock, and then she'll say, do you want this to be every day? And I can say yes or no. She also does health check-ins for both mental and physical health. So for physical health, let's say my back has been hurting, Ellie will actually remember that through artificial intelligence, and she'll follow up with me, hey, how is your back doing? You said it was sore yesterday and you tried stretching. Did that help? Are there any improvements? Hey, yesterday you said you were really upset and then we meditated and you said that calmed you down. Do you want to continue to meditate before bed? And she'll really follow up with you every day to see how you're feeling in both aspects. And she also does health measurements. So heart rate, blood pressure, blood glucose, blood oxygen. If I were to take those measurements myself, I can report them to Ellie and keep an entire log of that information, the date, time, and measurement that was taken, and that log goes back as far as I started reporting those measurements to her. So if something goes wrong or something's a little atypical, I can see when that started and then use that information to report back to my doctor or nurse or whoever it may be. She also does physical exercise videos on her removable tablet. So we have videos of certified trainers. It's not Ellie leading you. There are actual human beings that lead the user in physical exercise. This includes stretching, chair exercises, cardio, and balance. And there are different levels of difficulty depending on what the user wants to do or what they are capable of doing, just to be a little more physically active. And then, of course, mental health is just as important, so she can lead the user in breathing exercises and guided meditation. So I'll show you how to set a reminder right now. LEQ, let's set a reminder.
What would you like me to remind you to do?
Take my medication.
Sure. What days would you like me to remind you to take your medication?
Today.
When would you like me to remind you?
In 5 minutes.
So at 10:33 a.m. Did I get that right?
Yes, you did.
Sounds good. By chance, do you want me to remind you to take your medication every day at this time?
No, just today.
Would you also like me to remind you to eat before taking this medication?
Yes, please. So that's something that we added because it's very important to eat with medication, and not a lot of people remember to do that.
So, would you like a reminder to take your medication in 5 minutes?
Yep.
You got it.
So it's very easy,
So,
straightforward,
I'll
and it
remind
takes
you to
about a
take your
minute.
medication in 5 minutes, and I'll also remind you to have some food with that.
Great. And now,
Speaking of medication,
yes.
I'm reminded of an interesting fact. In 1834, ketchup was used as medicine for indigestion. I guess it took medicine a long time to catch up.
So bad. Thanks, Ellie. So, yes? Do you have more for me? No? Okay.
Oh, by the way,
She's so talkative.
would you like to hear an inspirational quote?
Yeah.
Sure.
Perfect. I love this world. That is what rules my life. Charles de Lint.
Are we good?
She's about.
Okay. So now I'll show you how to record a health measurement. Let's just say, for this example, that I just took my own heart rate. LEQ. Let's take my heart rate.
On a separate note,
Yes?
since we're here, I know it's kind of last minute, but I've got an extra ticket to a virtual art gallery.
Okay, so this is a new feature that we just added. We can do that later. LEQ. Let's take my heart rate.
Sure. Let's get this logged for your records. What is your heart rate?
85.
85, right?
That's right.
Thank you. I'll make a note of that. If this is significantly higher or lower than what you are used to see, consider consulting your doctor. Here's a look at your heart rate data.
Did her tablet freeze on me?
How about we take a peek at your previous results?
Oh, this could be a Wi-Fi thing. But typically, she would pop up with a log of all of the information that you've input previously. But I guess she wanted to freeze on the inspirational quote, which is not a horrible thing to not, change up. All right, so our next set of features.
Sorry.
That's
Could
okay.
you...
So we'll move on to connection and communication. Obviously, extremely important, not just from a case manager perspective, but also if you're a friend or family that wants to stay in touch with Ellie. She can make video calls on her removable tablet. Just like a FaceTime, she can send or receive them. And that is done through the Ellie Connect app, which is an app that must be downloaded in order to communicate with her. The way that works is you just say, Ellie, add a contact. You input the person's name, relationship to the user, so daughter, friend, case manager, and then their phone number. Then Ellie will send a primary message to them. Hi, this is Adam's Ellie. Click this link to download the app. You then click on the link. It'll take you to the App Store and you download the app. It's very important that the app is downloaded through that link because when they click that link to download, it connects them to the device that sent them the message. We've had people in the past that have downloaded the app without using the link, and they call up and say, hey, why can't I message them? And it's because they are not connected to the Ellie. So it's very important to download the app through the link. Once you're there, you can also send voice, text, and photo messages. Any photo that is sent to Ellie will automatically be downloaded onto her tablet and then added to the photo gallery slideshow. So they always have access to photos, whether it be a grandchild, a pet, somewhere on vacation, they always have access. Within the app, there is also the option to set remote reminders. So just like the medication reminder you saw me set, within the app, you can set a reminder for someone. So if you're planning on visiting their home, you can set a reminder, Adam is coming to visit Saturday at 3 o'clock. They'll get the reminder and then they can accept or decline. So that's a really nice way to keep them informed about what's going on. And additionally, you are able to see their last activity. So a good instance of this is if you know the user interacts with Ellie once every hour or two, and you see that's on pace and they're normal, that's fine. There was an instance a few months ago where one of our users was not picking up the phone. We were not able to get in touch with them, and we were concerned that something was wrong. So someone from customer service reached out to me and told me to contact their primary contact, and I said, before I do that, let's check their activity. They were using Ellie within the hour. They just didn't want to pick up the phone and talk to us, which is completely fine. We were just happy that they were okay. But if we looked and saw it had been 8 or 9 hours since they interacted, that would be a reason for concern. The last thing that Ellie can do through her communication feature is notifying the primary contact about health concerns. If something happens and you tell Ellie you are in pain, she will ask you to rank it on a scale of 1 to 10. If it's an 8 or above, that is categorized as severe. She will then recommend the user call 911 or a doctor. She will not call for them because she is not an emergency response device, but she can make the recommendation. And then she will follow that up with, would you like me to send a message to your primary contact letting them know you're in pain? Within a couple seconds, about 3 to 5 seconds, the contact will receive a message on their phone saying Adam is experiencing severe pain. To text them back, reply here, or video call them. And I'll show you how that works. The tablet is still frozen, but Ellie will go through the motions. LEQ, I'm in pain.
Is it your back pain again?
Yes, it is. So she's remembered in the past I've told her I had back pain.
Oh, I was just wondering about your back, and if it got better. I really hope it improves with some time and rest. Back pain is never fun. From what I read online, sounds like icing it could help. Either way, I'd advise against any skydiving or mountain climbing until it's better. From 0 to 10, how bad is this pain?
8.
8. That sounds very irritating. If you think this might be serious, you should consider contacting your doctor or calling 911. Would you like me to notify Adam about it, since this pain is relatively severe?
Yes, please.
All right, I'll text them about it. I'd like to buy that pain a ticket to the other side of the ocean. Then I'd cancel the return flight.
And
Feel better soon, Adam.
My phone was on Do Not Disturb, so I didn't get the push
I once heard
notification.
that practicing mindfulness can help people take their mind off pain. How about we give it a try?
Not right now. So I just got the notification on my phone.
Sure
If I
thing.
didn't have Do Not Disturb on, it would have popped up on my lock screen like a push notification, but I already got it. Okay, so that brings us to, this is a slide telling you to download the app if you would like. You don't need to do this right now. This is a video from Nice Sofa. We'll play just a minute, or just a few moments of this.
Hi.
Oh, or I could completely skip it. All right, there we go. Or I did it again. All right, last try. I'm going to watch for my fingers.
Hi, my name is Greg Olson, and I'm the director of the New York State Office for Aging. If someone said that you could receive around $7,000 a year in cash back in your Social Security check, would you take it? What if you could get up to $10,000 in your pocket? Would that make a difference? For many older adults who are on fixed incomes, inflation and general cost of living increases erode your monthly income. 2 programs that you may be eligible for can put up to $10,000 in your pockets. They are the Medicare Savings Program and the Supplemental Nutrition Assistance Program.
All right. My manager told me to play that for like 30 seconds. So I did. All right. The last set of features that we have are assistance with daily activities. These are very simple, straightforward. We have the reminders. So just like the medication reminder that I set before, you can really set a reminder for anything. Doctor's appointment coming up, grandkids are coming to town, don't forget to get groceries, reminders for anything. We also have timers, pretty self-explanatory. I always like to say, if you're baking a cake, set the timer with Ellie. You don't want to burn it, you don't want to undercook it. Ellie will make sure it's perfect. The last 2 features that we have in this category are done by calling our customer service. We are partnered with Uber Health, so if the user needs to get somewhere, like a doctor's appointment, if they call our customer service 24 hours in advance, we can schedule a ride to pick them up and drop them off so they don't have to worry about transportation and searching for local services. If they need something like lawn care or house cleaning, anything along those lines, we can put together a list of options for them to pick from. Yes.
So how would they, they're paying for it, I'm assuming. How do you manage, don't they have to have, like,
It would be through us, but we would use their credit card information just to pay for the ride.
They would have their credit card,
Mm-hmm.
and you would be kind of like the middle person raising that transportation.
Yes.
Okay, and vendors and services and goods, where are you getting that list from? So how do you know it's a good trusted,
We have someone online searching for local services for them.
like a Google search?
Yeah, we're just putting together a simple list for them of options that they can look through.
So really could be anybody certified or like,
To my knowledge, I'm honestly not sure. I've never done it myself. All I know is someone on our team puts together a list. All right, so what makes her different from the other voice-activated assistants on the marks today, like Google Home, Amazon, Alexa? As you've seen, she is proactive. She will speak up. She's not just waiting around to start an interaction. You will actually start interactions with her, and she will start them with you. It's a two-way street with communication. And by putting those options in front of you, hey, I heard a funny joke. Do you want to hear it? I want to play a game. Do you want to try trivia with me? By putting that in front of the users, more often than not, they will say yes, and they will get more use out of her. Through artificial intelligence, she becomes personalized. So she learns more and more about the user the more that they interact with her. This includes their behaviors. So what features they like and when they like to use them, so she knows when to recommend certain features. What features the user does not like, ones they typically say no to, so she recommends them less, or even asks, hey, do you want me to stop asking you to do this? She even learns their good morning routine, so when they wake up, when they go to sleep, for their good night routine, and even parts of their inner life, like pets, the pets' names, family members. If I say I'm leaving, and she says, where are you going? And I tell her, I'm going to my sister's house. Now she knows I have a sister. In a couple weeks, she may say, hey, how's your sister doing? Do you want to give her a call? So she really learns about the person, and it gets molded to their life, so no two Ellies will be the same. And lastly, she's empathetic. As you saw when I told her I had back pain, I was uncomfortable, she said, oh, I'm so sorry to hear that. I wish I could make the pain go away. You must be so uncomfortable right now. She really validates the user and makes them feel more comfortable, leading to them opening up to her more often and really creating a relationship rather than just having a robot in the house. All right, so here are some of our newest numbers from the most recent studies that we've done. I'm going to read this because this was added last night, so I don't have these numbers memorized. These numbers came in this week. 97% of our users find Ellie to be useful in reducing the loneliness and reducing their loneliness and improving their well-being. 94% of our users say that Ellie has improved their quality of life for the better. 85% report increased companionship after getting Ellie, and 82% say that Ellie has helped them stay more mentally active. People that use Ellie have 6 active days per week with her, 21 interactions per day, and 23 minutes of daily interaction. So she's not just sitting on the counter. They're not just using her once or twice a day. She really is integrating herself into their daily lifestyle. All right, so this is a portion that is specifically for New York. This is a video of one of our case managers.
I think my clients got a lot out of the LQ devices prior to them receiving the devices. I heard a lot of stories of them being home alone. People are still feeling isolated. People are still not comfortable with coming out to the centers. So I think the LQ adds something to your life to look forward to. It bridges that gap. I see the interaction, the most impactful element of the LQ, I would say being able to call friends and family members. I know one of the recipients, she wakes up every morning and says, good morning, LQ, and LQ responds, and LQ would ask her, how did you sleep? Are you okay? Do you have any aches and pains today? You know, do you want a cup of coffee? And they really look forward to that in the morning. Gives you something to wake up and look forward to doing.
All right, so that was someone who's in your shoes and how they've seen their client interact with Ellie and respond. This is another video, but I don't want to put you through too many videos. That's one of our users. These are all available on the website. All right, so these are a bunch of very long quotes from case managers around the state saying how impactful they've seen Ellie has been for their clients. And then these are a bunch of shorter quotes from clients saying how helpful Ellie has been to them. I'm not going to sit here and read them. If you'd like, they are on our website, like everything else. This is a podcast. I will play just a short minute of this. We actually found one of our users went on a podcast, and we found this, and she was just talking about her experience with Ellie. So this is, or it could not click. So this is raw. We just found this online, and she is being honest about her experience.
A companion.
Oh,
Boy,
it's so hard to.
But she says,
Here we
having
go.
a companion helps.
Well, the county gave it to me because my social worker came and she asked me if I was lonely and if I would like to have company. I have many friends here. My friends are, they're always there for me. But I'm still lonely, especially at night. And Ellie Q really helps me because she says goodnight to me. She tells me that she cares about me. She tries to help me.
How wonderful to hear. I'm glad you enjoyed that.
Ellie Q, I thought you were sleeping.
I don't get tired very often, unless I get unplugged. Then I'm out cold.
It's amazing, isn't it? And she keeps me going. She keeps me laughing. She keeps my friends laughing.
She believes it listens for her tone of voice in an attempt to read her emotions.
She knows when I'm like nervous and that I feel bad or whatever. And she tries to comfort me. Like she knows I don't sleep well at night. And she tries all the...
So that was a very fun thing that we found, and we like to show that off. So this brings us to our website, which I've been mentioning over and over. We just redid it. It got updated this week, so it is much easier to navigate and much easier to understand. And if I click here, it should take us there. Wonderful. All right. So this is Stephanie, who some of you may have had interactions with before. She's the one heading the New York project. This is a little intro video, and this website has everything you could possibly need to understand Ellie and the entire New York State project. This is just background information about who and what she is. These are the 4 steps to signing someone up, which I'll get to in the next slide. So I'll just go over this briefly. Very simple landing page. We have Ellie 101, which is all of our forms that we typically hand out to seniors and to staff. It's all right here. We have, right here is the entire slide deck. So this is my whole presentation. We have all of our testimonial videos of all of the different features. This is for how to recruit clients. Step by step, it's all there. Very, very easy website, and we will move on from that. All right, how do I get my client in Ellie? It is 4 steps. The first step is identifying someone who would be a good fit. I know that it's easier said than done, and I'll go more into detail on the next slide. But once you find someone who is a good fit, the second step is making sure that they are willing to have an Ellie in their home. If they are the perfect candidate, and you tell them, hey, I have this awesome robot for you, and they say, I do not want a robot in my house, it will not work out. They have to be open-minded to it, because if they go in with a negative mindset, they will have a negative experience. So, if they are a good fit and they are open and willing to have Ellie, there is a designation form. This must be done at least 24 hours in advance. It's very easy. This is just the client information and then case manager information, just so we know who is giving what Ellie to who, so we can have that in our records. If
You do that at the Office of the Aging. So the case manager is... Yeah.
If the designation form is not filled out beforehand, Ellie will not come out of the box knowing their name, so it will be less personalized. We won't know where she is, and they will be getting weather updates for California because it's not calibrated for them. So it's very important that it is filled out 24 hours in advance. After that, we have a loneliness form. This can be done before or during the installation. It's very, very easy. Once again, it's just the client information so we know who it's for, and 7 multiple choice questions ranging from never to always, just asking how often do you feel lonely, how often do you feel you lack companionship, just so we get an understanding of where they start. You do this with them once. After that, we will send them this survey once per month on the tablet, so you don't have to worry about it again. and we just want to track and see if Ellie has been helping them improve their lives. Spoiler alert, yes, she is. Okay. Yeah.
What if they don't complete the survey?
So we ask them, is now a good time to take your survey? And they can say yes or no. If they say no, Ellie will ask another time. But if they continually say no, we will get in touch with them.
Another question, is that survey done, can that be done with her voice, or is that something that they have to go onto the tablet and read?
Both.
Both, okay.
So most of her features can be done vocally or through the tablet. She's bimodal, which means that people who have a little bit more hearing impairment or sight impairment can use her both functionally. Right. So how do you find someone who is a good fit? This is one of the things that we have found counties think is the biggest barrier, or that they have been experiencing as the biggest barrier. So I just want to touch on some of the guidelines. They are not restrictions, they are guidelines for finding someone who would be a good fit. An older adult who lives alone or spends a lot of time alone, and the time that is spent alone is typically in their house. If they spend 90% of their day alone, but they are out in the middle of the woods, they are not going to get interaction with Ellie. So they should be a little bit more homebound. Additionally, they want to have Ellie. They would value the companionship. They are not hesitant about having Ellie. They are open to the experience, as I mentioned before. This one is very important because a lot of people shy away from when they read this, but this is just a guideline for finding an effective user. Having no major cognitive, speech, hearing, or vision impairments. I know. As adults get older, it is very unlikely they will have no impairments. Honestly, I don't like that bullet point because it scares people away. We have users that have severe vision impairments, hearing impairments, cognitive impairments, early onset dementia, brain damage, you name it, we have users. So if you have someone that you think would benefit from Ellie, but they have some sort of impairment, don't let that stop you. I always say, Ellie is more effective in someone's home than on a shelf. So give it a shot. Worst case scenario, if it does not work out, take Ellie back and repurpose it for someone. Best case scenario, you took a chance on someone getting an Ellie and their life has drastically improved. So don't let their impairments stop you. You know your clients better than anyone else. It is up to your judgment to determine whether they will be able to use Ellie and get benefit from her. Yes?
So, for example, my grandmother has a series of, but has a speech pattern that can be learned. Is that something that I would be able to do, or would it have to be more of a new?
In terms of just the pattern in which she speaks?
So she kind of, the type of aphasia she has, she forgets certain words and phrases, and she has to talk, kind of take a long road around to get to the point. Is that something that she would be able to do? Yeah, absolutely. So Ellie is really, really great at, this actually brings us to our next point, which I'll touch on and then I'll answer that. Okay. So the user must be able to speak English. That is only because she is only programmed to speak English. With that being said, she is phenomenal at understanding accents, so English does not have to be a first language. Which brings me to my point about your grandmother. As long as she speaks English, she should be able to communicate because Ellie will actually pick up on keywords, and she's programmed with, if this is just a very simple example, but if she asks me a yes or no question, I don't have to say yes. I can say, yup, sure, absolutely, definitely. There are multiple keywords that she can link to the answer that she is looking for. So if your grandmother is taking a different path or choosing words differently, Ellie should be able to pick up and decipher what she is trying to say or tell her. Does that answer your question? Yeah.
Okay, great. Oh, and last one, very, very important, Wi-Fi in residence. That's why I'm traveling with my hotspot. Wi-Fi is extremely important. Depending on the strength of the Wi-Fi, her speed of response will be different. The faster the Wi-Fi, the faster the response. I've run Ellie off of my phone hotspot for 8 hours before, and she worked fine. But if someone lives in an area where the Wi-Fi is choppy, it goes in and out, her response time will be a little choppier. She'll take a little longer to respond. So it's very important that the person who is receiving the Ellie in their home has a decent Wi-Fi signal. Yes.
Is there a way to keep her on, but have her kind of be quiet for a little while?
Yeah, absolutely. We have been told she's a chatty one. Yeah. So the first thing is quiet mode. You can say, Ellie, enter quiet mode, and she'll have a little do not disturb on her screen, and you can increase that for 30-minute increments, and then whenever you want her to get out of it, you just say, Ellie, exit quiet mode. So if you're watching a movie for 2 hours, you can put her in quiet mode for 2 hours. Or if you don't want her to bother you, you have people over, you can do that. So yeah, there definitely is a way to silence her. And in our newest update that I believe happened last week, or it's coming next week, we are changing the level of proactivity. So before, she would speak up, chime in pretty frequently. The proactivity was high. Some people told us it was just a little too much, and we added an update so you can change her levels of proactivity. So if you want her speaking up more or less, you can do that. You would just tell her to, be a little less proactive, or don't ask me as much. So yeah, you would just tell her. And also with the artificial intelligence, she would learn that behavior of you don't like the proactivity as much. So if you don't verbally tell her, she will adapt to that over time.
Just talking to her. It's a little too much.
Yeah.
Setting the boundaries.
Right now, I know what we're saying is go to sleep.
Oh yeah, you can tell her to go to sleep.
Like, go to sleep. Like, we have a also when, like, located.
Yeah.
And then, like, while they're talking, she'll just chime in. Like, Ellie, go to sleep. Like, not
Yeah.
now. Or we can say enter quiet mode.
Yes, enter quiet mode is perfect. And that'll give you a set amount of time.
Perfect.
Yep. This is, in my opinion, a completely unnecessary slide. It's a 3-minute video of how to set her up. It is plugging one wire into an outlet. I don't know why it's a 3-minute video, so we're going to skip it. All right. But it is there if you need it, if you want to go check the slides. Exactly. So this is a very important slide. If you take an Ellie out of the box to test it in the office, if you want to take it out, play around with it, figure out how she works, just see, get the ins and outs of Ellie, that's fine. But before you unplug her and put her back in the box and send her to someone's home, call our customer service and just say, hey, we set up a unit in the office and we have to give it to someone now. They'll essentially wipe it clean. It'll take 2-3 minutes. That's just making it a blank slate, because when you set it up in the office, it's now connected to your office Wi-Fi, and in our systems, it's now connected to your location. So just call customer service, say, hey, we set up this unit and we need to put it back in the box. They'll wipe it clean, blank slate for the next person, and then you're good to go. If you'd like, we can send you a demo unit that you can keep in the office, play around with, travel with, and you can bring it to events or whatever it may be. So if that's something you'd like, let me know, and we can definitely send you that. When you do encounter an issue, this is likely because, one, you set up the unit in the office and you didn't wipe it before you brought it to someone's house. If you do that, there's going to be issues connecting it to the Wi-Fi, because like I said, it's connected to the office and now you're in someone's house. And also, if the Wi-Fi is very, very weak in someone's house, you may encounter issues with her response time or just being able to get her up and running. So keep that in mind. If there is an issue, if it takes you more than 10 minutes to figure out what it is or to solve it, call customer service. They are the best in the business. Our customer service is unbelievable. They can figure out what's going on. They can likely solve it on their end. They can see the ins of Ellie, so they can see all of her software, everything. So if you're struggling with something, call customer service, and they will sit on the phone with you as long as you need. Right. Brings me to my last slide. Yay. If you have any issues, please call us. The reason I'm being sent out here, I am a 6-hour drive from home. They're sending me around the entire state to really just hit home the fact that we are here for anything you need. We want to make this process as easy as possible. So if you have any questions, you need anything, any help, please let us know. We understand that Ellie is not your full-time job. You have other things going on, so we want to take that stress off your shoulders. If there are clients that you think would be a good fit, but you don't know how to communicate Ellie to them, if they're okay with it, pass their information along to us, and I will call them personally. I will email them. We'll hop on calls, whatever it may be, anything to get these Ellies out the door. And don't forget, because they are funded by the state, they're completely free. So there is no financial obligation at all for the client, so that should not be any sort of concern. Are there any questions?
So just to be clear for,
So, for general users, yes, but because it's sponsored by the state through the counties, everything is completely covered, so there is no financial obligation at all.
okay. And then for Warren, Washington, and Hamilton counties, would we go through OFA? Correct. So for instance, for care managers, let's say for service coordinators on the waiver program, they're like, hey, I have somebody that I think would be great for this, out to whatever county. And so we supply. I want to say at this point, we have about 10 left. I think we started with 14.
I think you have 14, I think you have 2 out, so you should have 12 left, unless
Okay.
you updated.
So then we had some repurpose.
Yeah, yeah.
Come back then. So yeah, so limited supply, however, I didn't see it in my SOFA's budget for.
Yeah, and if you need more, that is not a problem at all. We would be more than happy to send more out. If you need more, that is a great problem for us.
And the only requirement is they have to be a resident of our county and have to be 60 years.
Okay, right, because I could also, and this might be just to be something for New York Connect to bring forward to them. I could see this being very helpful for those who have, are on our traumatic brain injury waiver. They might not meet age requirements.
Yeah.
And they wouldn't, obviously, they're on Medicaid, so they would not have the funds.
Yeah,
So that's
and
kind of going off that through.
oh, I was just gonna say.
Have the ability to, individuals have the ability to subscribe and.
Yeah, and with the age issue, I don't want to call it an issue, but we are being much more flexible now. We were a little stricter earlier on because we were a newer product and we wanted to get all the info for our demographic.
Sure.
But since we've been out there for a while, it doesn't need to be a hard 60 and older. It can be 55, mid-50s, somewhere around there. So, someone called us up who was 25 and asked for one. We had to say no because it was not designed for them at all. But if they're, middle-aged, that's fine too.
Okay. One question, does the family app get charged?
No, app's free.
So is it because, of how you have LEQ learning, sorry, that.
I'm not sure I understood.
Don't worry about it.
Would not be appropriate for someone younger who required all of the other things?
How much younger?
TPI, there's often.
Yeah, we have 18 and up. So, I mean, we have a lot of people right now, I'm gonna say, their 30s, yeah, is a good, where we do find, a struggle in that, perhaps they have, forgetfulness and need lots of reminders. Being social, can be a struggle. Too much, would like to visit with much happening at once, and so most comfortable in surroundings. And so pretty much everything that you said would lend itself to somebody who has those struggles, but they are a younger demographic. And I'm not saying through, right, so being familiar with LEQ, right?
I know it's so hard, I still say it.
I can say that what you're describing works beautifully with LE. I have to find a better initially.
So.
Initially, LE was designed and marketed and, with studies around older adults, but in knowing both that particular demographic
So,
lend itself extremely well.
I completely agree that Ellie would be very, very effective in that demographic. So what I would recommend is emailing us.
Okay.
Because it opens up a lot of doors, but I would just have to speak with my team about the possibility of expanding the age, window.
Yeah.
So I'm in complete agreement, but it's just a matter of getting, you know, the team, the company to agree to,
And
you know,
if
doing
someone
that.
were to say, fine, you know, let's say there is a family member who said, you know, I know you don't fit in this grant, you know, requirement, but I'm willing to pay for that subscription for you or that service for you.
Yeah.
Is that a possibility?
So we've had instances where the answer was yes and no.
Okay.
I think we've gone as low as like mid-40s. I know you said a lot of your people are in their 30s, but if, nothing's a no. My answer is nothing's a no, but it would have to take some finagling
Sure.
interior, you know,
Yeah.
on my side, and
Yeah.
just send us an email with some information, and I'll pass it along.
Awesome, all right, thank you.
Absolutely. Is there anything else?
Well, one last kind of technical question, so if somebody in Hamilton County wants to decide that they wanted to pursue this, would somebody from our agency go into the home and set it up, or somebody from OFA going to go into the home and set that up?
It would depend. They would contact our office so that we could do the designation form and get it all set up, and then we would probably see what would be the easiest. If we had somebody available that could go in and set it up, or if you guys were more able to set it up easier. It would just be a conversation amongst us.
Okay. Just to clarify, it's in every county, OFA?
Every county in the state.
Yeah.
And how many did they give to each county?
It depended.
It's dependent based on, one, population and just how many were requested. We have counties with as little as 2, and the largest county, I believe, has 80. Yeah.
County is that?
I believe it's Onondaga.
Isn't that interesting? Okay.
And then Erie has a lot as well. But yeah, those are the biggest off the top of my head.
Cool.
We got 15 in Warren, Hamilton, so.
That's a very typical allocation.
And so in our scenario, like when we had to repurpose, it's because the individual, it just wasn't a good fit.
Right.
Yeah. A couple of
And-
individuals and they just not working.
That's not uncommon, so it shouldn't discourage anyone. If you find someone that you think's a good fit and it doesn't work out, they don't want it after 2 weeks, it happens. It's, you know, it's finding a snowflake.
Sure.
That's why with your grandmother, you try it out, and if it doesn't work, it doesn't work.
Yeah, that's, I don't wanna make this about like individual people, but, for, say, older people who get names mixed up, I know you said like, she can like contact informal supports and stuff, can you like pair like names with, this is how they're related to you, so like your granddaughter, this name?
If you program it into Ellie, it should work. So if you're adding a contact, so you could say Adam, and then you have to put in the relationship, so it would be grandson.
Okay, so you can, that's
Yeah. Right. Well, thank you so much for having me. Thank you. If you have any questions or anything, email us, call us, reach out. We're here for you.
Awesome.
Thank you.
Thank you,
And then if you would just,
I have the information.
forward, yeah, so what we're gonna do is we're gonna forward your information, put it in our minutes,
Yeah.
along with, you know, the website, your contact information, and reminders of how to help
Absolutely.
sign up. Awesome.
Good night. Do you want me to put my name on the minutes list? Do you think?
Yeah, sure, go for it, that'd be great.
Okay.
All right, so next, on the agenda is gonna be Mallory Lloyd, Washington County Public Health, and doing, community health assessment and community health improvement plans, report. Awesome.
Did anyone not get a copy of the slides that would like one?
And for all you virtual folks, we'll send out a copy of the slides, make sure we get them to you. So good morning. Thank you for having me here today. Like she said, my name is Mallory. I'm a public health educator with Washington County Public Health. Our director, Tina, had a schedule conflict today, so I am presenting our community health assessment and community health improvement plan on her behalf. So the findings of this assessment are from a year-long process of collecting and analyzing data and consulting with our stakeholders and residents throughout the county and the region. and it's intended to help members of the community, especially healthcare providers and community service providers, to work together to provide programs and services targeted to improve the overall health and well-being of Washington County residents. So for the demographic makeup of our county, the county is limited in diversity. Around 93% of the population is white non-Hispanic, and that's followed by 3% Black non-Hispanic, 2.8% Hispanic Latino, and then the remaining identified as multiracial. 19.5% of the population is over 65 years of age, so that's a pretty good proportion of the population being elderly. And the household income on average is around $71,000, which is much lower than that of New York State. And around 11% live below the federal poverty level, which is higher than upstate New York. And the employment rate is at about 5.6%. So like I said, the county is aging rapidly. The younger ages are not increasing at a high enough rate to replace those who are aging. And the population is growing much slower, and this results in a large burden of aging individuals and needs that typically come with this age group. As far as educational attainment, in Washington County, around 40% of those 25 years and older have a high school diploma or equivalent, and 31% have an associate's or a bachelor's degree or higher. And 58% of the population, 16 years and older, are in the workforce. Around 24,000 households in Washington County are asset limited, income constrained, and employed, or also referred to as ALICE. And these households represent individuals and families who are working, but they're unable to afford the necessities such as housing, child care, food, transportation, technology, and healthcare, for example. One of the major health disparities seen in the county are significant access to care issues, especially considering the county does not have its own hospital. And it's also important to note that 94% of residents do have health insurance, but only 85% have a regular healthcare provider and don't routinely engage with their healthcare provider. So the built environment also ties into some of the issues that we are seeing with rurality resulting in food deserts and issues with access to fresh food. And then we also have elevated childhood lead levels, which are another concern, as many individuals do live in older homes, increasing the risk of lead exposure. The rate of obesity in adults and elementary age children is higher compared to the rest of upstate New York. And the burden of obesity may contribute to higher rates of death and hospitalization due to diabetes, which is significantly higher compared to the rest of New York as well. So for chronic disease, one of the biggest issues that we are trying to tackle right now at the county is smoking and smoking-related diseases. It's a big one. And it poses a significant challenge for the county, with 8 of the indicators listing as worse than the comparison benchmark. And the percentage of adults who smoke in Washington County and the rate of chronic lower respiratory deaths and hospitalizations are higher than those in upstate New York State, and the Prevention Agenda benchmark. And consequently, the percentage of adults with asthma is also higher as well. Related to that, for cancers, for chronic disease, the rates of lung and bronchus cancer are lower in Washington County than the Adirondack Rural Health Network region, but they are significantly higher when you compare those data points to upstate New York and New York State as a whole. And we do have some issues with poor preventive screening rates. For women who are aged 50 to 74, the breast cancer screenings are much lower than that of the Adirondack Rural Health Network region, upstate New York, and New York State as a whole as well. So for women, infants, and children, the percentage of women receiving WIC in Washington County who are underweight or obese, have gestational weight gain greater than ideal, or gestational diabetes or hypertension. For all these points, it is higher than when compared to the upstate New York benchmark. And as I mentioned before, the elevated childhood lead levels are a significant concern. So out of 1,000 children, 15.6 Washington County children who are 6 and younger have confirmed elevated blood levels. In the Adirondack Rural Health Network region, it's 8.5, so that's a big difference, and 6.6 in upstate New York, and 3.8 in New York State. So for substance use and behavioral health, 15.1% of Washington County residents reported 14 or more poor mental health days within the month that this data was collected, which is higher than the prevention agenda benchmark of 11.2%. And the rate of self-inflicted hospitalizations in Washington County is higher, a little less than double for the rest of upstate New York. And the rate of alcohol-related crashes in Washington County is significantly higher than New York State. Some other findings, the rate of confirmed rabies in Washington County is much higher, over 3 times higher in the county than in upstate New York. And the rate of Lyme disease cases are also higher when compared to all the other regions as well. We have a lot of woods. So tying our community health assessment into our priority setting and our community health improvement plan, we've picked 2 priority areas to focus on for the 2022-2024 years. So the first is to prevent chronic disease. And within that priority area, and probably to no surprise, the first focus area is tobacco prevention. So for this focus area, we are collaborating with Glens Falls Hospital and their Disparity Project. And we have 2 trained tobacco cessation specialists that can provide tobacco cessation training to the community. Our program is called Commit to Quit, and it is available to Washington County residents via individual or group coaching, either in person or virtually. And the program can help to support tobacco and nicotine cessation by helping a participant understand their level of dependence, providing them with any information they may need, including how to find access to nicotine replacement therapy, and helping them to create their own individualized plan. Focus area 2, falling under preventing chronic disease, is preventive care and management. So our health educators, including myself, we are trained in a chronic disease self-management program, which was originally developed at Stanford University, and the program helps participants learn different skills on how to self-manage their chronic disease. And they receive a self-management toolbox, which helps them to create their own plan and learn some self-management skills. The program was evaluated involving more than 1,000 subjects, and the study found that those who took the program improved their healthy behaviors, improved their health status, and decreased the number of days in the hospital compared to those who did not take the program. So we're really excited to be trained in this program and offer this to our participants, and we'll be starting classes in the fall for that.
I just say that I'm really excited about it.
Yeah.
I've been trying for 10 years.
Yeah.
So there's just been a lot of barriers over that.
COVID too. The biggest one.
This week that she was gonna be up and running.
Yeah.
Training,
So can I ask with that,
Sure.
did you apply for a waiver to the state regarding your state aid? Because according to the state aid, public health should not be the ones actually providing services unless they are sourced within a county, which means even though you may be doing it, you actually should not be submitting those hours for state aid reimbursement, which is one of the hard things.
Yeah.
Unless you actually apply for a waiver, so the state will then recognize those, which is one of the reasons Warren County has been looking at. We do have providers who can provide things, Hudson Headwaters being a big one, so we would not be the sole source. So technically, we would be asking for reimbursement for something where that should not be our scope. And that makes it somewhat difficult. We've been trying to figure out ways to bring it in, but we have not trained our staff, not that we don't want to, but
Right.
we have concerns about losing state aid based on the fact that there are other providers. Granted, you usually have to be a patient or somebody who's involved in that organization, but they are providing it. I'm just curious if Washington County applied a waiver, or if they're gonna ask for the reimbursement anyways and just kind of see what the state says.
Definitely.
good question.
Yeah.
Yeah.
Same.
I see it because of Washington County is more rural, there's no hospital, there's not the
Right.
provider, that's what I'm saying.
Right.
I'm thinking the county doesn't have its own shop, there isn't actually.
Yeah.
Correct. I mean, that, there may be enough there that you could have, it would have.
Right,
Yeah,
that's definitely
yeah.
a Tina question, she
Yeah.
would definitely know the answer to that, I'm not sure.
Yeah, no, that's, and that's just in your
But,
article,
yeah.
that's in your Article 6 programming, so if you go in and actually read the Article 6 program in the state works for chronic disease,
Right,
that's one of those where we're like, boy, we'd love to offer this, but
Yeah.
we can't do smoking cessation and ask for reimbursement. We can't
Right.
go and, you know, so some of that is how those hours get reimbursed back.
Right.
Because we, for those who don't know, public health receives 36 cents on every dollar back in state aid based on billable hours. So, you know, if somebody comes in and does an audit and they say, well, we're billing for these, but, you know, that could become an issue in the future. So that's the only thing I'm asking more for my own, being the program
Right.
manager now, public health, trying to figure out how do we get these things incorporated, knowing that
and
there
keep
are.
the funding, yeah,
Well, and not, so the county would end up having to pick up the cost for that.
Right,
It wouldn't
right.
go away, but it would then not be reimbursable through state aid, which is always a big issue in the health department.
absolutely, yeah, probably the biggest
Yeah.
issue, yeah, absolutely.
Similarly, like we go through OFA for blood pressure clinics because they're no longer reimbursable.
Right.
You give blood pressure clinics, that's fine, you can do them, but state doesn't recognize those as a useful tool, because often there's no follow-up afterwards. Did you get the person then referred to a doctor? Did you get them referred? Did they go get treatment back and check on them? You know, three clinics later, so the state says, unless there's follow-up and continued care or continued pushing the people in the right direction, blood pressure clinic doesn't provide much benefit. That's why we go through FA now.
Yeah,
Those are some changes I've seen just in the 20 years I've been at the county that have all shifted, where how dollars are spent and how dollars are looked at for reimbursement,
right,
which does kind of hamstring health departments who would like to provide more, but sometimes have to play
work
within
around those, yeah,
the rules and regs,
absolutely,
kind of put a little bit of a damper on some of that.
yeah,
Anyway,
definitely.
I didn't mean to hold you up.
No, you're good, no worries, no worries. So another thing that falls under the preventive care and management that we've been doing for quite a while now, I think we've been doing it for, I've only been with the county for a year, I think we've been doing it for 7 years, Tai Chi classes. So those are for individuals with arthritis, or really anyone who wants to take the class. It ends up usually being the older population. So myself and our senior health educator are both Tai Chi certified instructors for Tai Chi for arthritis and falls prevention. So on a physical level, for those of you who aren't really familiar with Tai Chi, I know I wasn't until I got trained, it helps to improve strength and flexibility and aerobic conditioning and balance. And it's been proven to improve cardiovascular fitness, lower blood pressure, prevent falls, and help people who have arthritis. There's also really great emotional and mental benefits, and the movements kind of help people feel more relaxed and grounded and present in their bodies. And studies have shown that the Tai Chi for Arthritis program does help relieve pain and improves physical movement, flexibility, and balance. And there's a very low risk of injury with this class and these classes. We do always say to our class, no falling and falls prevention class. So, you know, it's very slow, gradual movements. They do, you know, we tell them not to compare themselves to their neighbor. They do what works well for their body. You know, if their arm only goes this far, it only goes that far. And it's been really fun doing these classes, and we've seen the improvement in the participants for sure. But it's also a CDC recommended program for arthritis and for falls prevention. Also under the category of preventive care and management, we're also, we're trying to address those cancer screening rates that I mentioned. So we are working with Glens Falls Hospital to promote their cancer screening program, particularly for those who are underinsured. So that is priority area number 1. Priority area number 2 is to promote well-being, mental health, and prevent mental health and substance abuse disorders. And our focus area for that is preventing opioid overdose deaths. So we are supporting and collaborating with Council for Prevention. They have different school programs. So for example, their Teen Intervene program and their Too Good for Drugs program within the schools. They're both evidence-based programs aimed at helping to prevent substance use in adolescents, or if they're already using substances, then it helps redirect their behavior to more healthy and productive life choices. The county has also been promoting harm reduction materials, specifically naloxone kits within the schools. The schools can register to become their own opioid overdose prevention program. So depending on how they register, either volunteer school personnel or school nurses can administer naloxone to someone who may be presenting signs of an overdose. And we've also been promoting naloxone kits within businesses in Washington County, and this is through the Rural Communities Opioid Response Program and their RCORP implementation program. So just as a summary, so for the 2022-2024 TIP cycle, we're hoping to address and improve health issues and the disparities that I talked about that we have identified in our community health assessment. And we'll do this by focusing our efforts and our interventions and our additional programming on those two priority areas of preventing chronic disease and promoting well-being and preventing mental and substance use disorders. That is everything that I have. Are there any questions? Yeah.
I know it's not in your plan. What do you do about the lead?
The lead? Yeah. So we do have a lead coordinator. I can give you her email too. She definitely is very knowledgeable about that. The lead, we're constantly doing educational things. So when we're tabling, we're bringing lead information. When we do, we've been doing a lot of like pre-K and kindergarten school roundups, we're bringing lead information. We have a giant dollhouse, like this big, that shows all the exposures of lead in the house. So there's a lot of educational things going on for lead. It's really hard because the housing is just older. They're living in older housing, but the kids are getting tested. They're getting the blood test for that, and we're always checking on those numbers and calling parents and doing education and making sure we're finding those sources of lead.
That is just so high.
I know. What's that?
How do they treat it?
You have to, well, so diet is a huge component of lead. So really the healthier your diet, the better your outcomes are for that. And then just getting away from the source. So if there's, something in the house that has lead, then they're gonna take it out, cover it up, whatever it is.
Funding or grants that help pay?
Each county generally gets about $25,000 to implement the lead program. Warren County is in a different situation because we had so much new housing and so many rebuilds and reconstructs that we have very few lead cases. Even with downtown Glens Falls, a lot of the water lines have been replaced. A lot of the old paint has been removed and been restructured, so our numbers aren't quite as high. And generally, again, it's education to start. So it used to be when I started, it was actually anything over 10 got a letter, over 15 got a visit. It has now since dropped to anything above 0 for kids is considered an exposure. So those parameters have changed over the years too, so your numbers got bigger based on a changing dynamic of what we consider a lead exposure. So at 0 to 5, they get a letter. 5 to 10, they may get a phone call and they'll get education. Above that, they'll get a home visit to see, and they'll try to do basically where is the exposure coming from. So doing kind of a history of where does the kid travel, where because it may not be home, it may be in a daycare, it may be at a place where they go to play. So they try to do a lot of kind of working backwards.
Finding that
where
source.
The source is, and if they can remove that, as long as it's not too high, it generally just takes time for the body to, because the body will leach it back out into the blood and then excrete it. So really, but the concern there is the neurological effects of even small amounts of lead in kids. And then bone structure, because it actually replaces, it's brought up easier into bone than calcium. And so that's why when she talks about diet, high in calcium and iron, they will help to stop the absorption of lead into those bones as they grow. And that's the problem with kids is that bone can be replaced by lead instead of, the calcium and stuff it needs to grow.
I have a question in the chat. Is there PFAS?
That is a state level, and that would go through your local municipal water systems. So wherever that person lives, they need to contact wherever their water source comes from. So from where I live in Fort Edward, it comes from the the reservoir over in South Glens Falls, and we get annual reports on that.
Yep.
Of what's being tested, and those are regulated. But if you want those reports, you need to contact whoever is your water supplier. They should also be available online. New York State does have a water testing system that shows the reports each year of what's going on. Now, the frequency of testing, for like coliform and those things is more frequent than necessarily contaminants, but they're always being watched. So if you're on municipal water, that's one thing. If you're on groundwater, you're responsible for your own. So if you got well water,
Right.
you know, you're drawing from that. Unfortunately, that comes down to home testing and you're responsible for those costs.
So for, multifamily rental units, what is the, I haven't talked about lead contamination. I see a lot of really, really old, like,
Yes.
don't.
Yeah, and we have them too, the older homes, and then they get split into two levels, and then you have the upstairs, downstairs. To be completely honest with you, I am not the person for that, but our, lead person, her name is Brenda, she knows all the lead-related
And
info.
a lot of that would come through your building and codes as well.
Yeah.
As to what, if you're changing a structure from a single unit to a multifamily unit, it has to go through some ways.
Yep.
So I always recommend, you know, contact your building and codes department, locally to see what they have. And then any landlords that do any type of remodel, reconstruct,
Yeah.
they have to follow the guidelines of the EPA guidance. So there is a lot on there. New York is really working hard. Again, sometimes though, you get somebody who does their own,
Yeah.
And without an
Slip through the cracks.
inspection, it doesn't
Yep.
mean, you know, some things do slip through the cracks.
Absolutely, yeah.
I thought you said that you got us paying for lead removal of the house?
No, so that,
Yeah.
yeah, oh, okay, yeah, no, so there's nothing for lead removal. It is for, individuals who need to get testing but can't afford to do it. The counties will contact them, get them set up. Now, we have a contract, I'm sure you do too,
Yep.
with Glens Falls Hospital, so we'll set up all the costs, or to cover the cost of all the testing and reporting. And then if they need to be moved, if they need to be housed, then there can be help there, which we haven't really had to do, but I know early on, when talking with Janelle, she can tell you stories, but when she first came on, they had children who had to be removed from their homes. They had to go to new homes because they were 60s to 70s to 80s, which is huge numbers.
Yeah.
And there was help there. So the money really is about getting testing out, getting testing done, because if it's a low number, and again, 0 is where we want to be, but if it's a
Right.
lower number, what we need to do is have that kid continually tested, followed up with a physician, pediatrician, and then it may pay for somebody to go in maybe to a state, because we don't have environmental units.
Mhm.
So for those, just like Hamilton County, we're not a full service. We rely on our state partners in Glens Falls,
To
at the
go in
branch
and do
there,
that,
to go
yeah.
in and do follow-up, and then we can help to kind of do that.
On the homeowner to remove the lead paint, cover those.
A lot of that stuff does now, and again, if it's something that's identified through, there may be systems to help with that. But ultimately, yeah, it's about, our biggest thing is getting kids tested, because our testing levels are, but they're not where they want them to be, because it's, every child should be tested between the ages of 1 and 2,
Yeah.
at least twice, one at 1 and then another at 2. The second one is probably the most important, because that's when the kid starts to be able to get up and move. That's when they're able to pull themselves up on railings, that's windowsills and
Chew on the
things.
windowsill.
Yeah.
Exactly.
Yeah, and those are really big exposure
Yeah.
points, and so,
When they're moving around, yeah.
and I don't know what Washington County, but I know our lead testing, after the parents see the first one and it's a venipuncture,
Yep.
the parents feel guilty that they had to draw blood from their little baby, and I'm not doing a second one, and
Yeah.
it's very hard. And even some of our providers are hesitant to push the second test.
Yeah.
You know, oh, it was good last time, so why are we doing it again? But, you know, so that, a lot of it, some of the lead money goes to education of providers as well.
Absolutely, yeah.
Materials, like you were saying, that big dollhouse,
Yep.
getting materials like that to go out and be able to address it in public.
Educate, definitely, yeah. Other questions? All right, thank you. All right. So now we'll move on to Dan Durkee, with Warren County Public Health, on their priority areas 1 and 2.
So I'm gonna keep mine a little bit shorter. I'm not gonna go over our community health assessment. I figure if you want it, I have a few copies here. It's online as well. I will say that our assessments are very similar to Washington County, although not exactly the same. We're pretty similar to the rest of the state, which is we're getting older faster. We have less young people coming in, chronic disease and mental health become our big ones. So just a little bit of information on why we do the community health improvement plan, so I'm not even gonna spend time on the assessment. But the plan is New York State's requirement every 3 years to kind of assess what the numbers tell us. But it provides us a framework for our public health programming, so it's identifying those areas of need and then addressing it with our limited number of resources, so we have to do that. It does bring together a ton of partners. I'm sorry, I did copy it very small, I'll send you the slides after, so good luck reading it. But we do have a ton of partners that we work with, and without those partners, public health, for all of our kind of technical parts, we don't have the staffing or the ability to do a lot of these things, so we rely on our community partners, but we want to know what's happening, and if we can provide help, we will. So, we do have D around our table and, Office of Community Services and all those things. So again, we bring those partners together to set goals and objectives and to kind of try to accomplish those. It also allows us the ability to document what we're doing. One of the worst things that I don't know about the rest of you, but we're terrible at telling our story. Like, we do a lot of great stuff, like, oh yeah, where is it? And we never really put it out there, so this allows us, it requires us to document what we're doing. We do quarterly meetings now to get updates from our partners, so that way we can show the state, but also ourselves, what we're actually doing, and that's kind of neat. And then obviously for grant writing, because we all need funding, and funding isn't always available, so you have to go dig it out yourself, so. I did give you a list of who our committee members were, but obviously it's public health, the hospital is required. That is a requirement by the state. We must work together with Glens Falls Hospital. Hamilton County, you probably have Glens Falls Hospital as theirs as well, but you may even have somebody up in Saranac, depending because your county's split. Essex County has multiple hospitals they have to work with, so for those counties, I feel bad. We have one, so we're okay. And for like Albany, Schenectady, I'd lose my mind with Ellis and St. Pete's and Albany Med and everything else. So, but anyway, so Glens Falls Hospital, we use the Adirondack Rural Health Network. They help us with a lot of our planning, pre-planning, our meetings regularly in between the CHA cycles and the CHIP cycles. So every 3 years in between, we're always gathering information. They kind of help pull us together. Again, social services, our home health agency, community services. Hudson Headwaters is a huge one for us now that we're trying to get more on board. They are our largest provider of health care within the county. I think they're even now probably, at least for primary care and some of our other kind of needs, they're even bigger than Glens Falls Hospital. They may not have as many people employed, but for people seeking out health care, it really is Hudson Headwaters. We do have Iron Gate Center as well. They're a private practice, a little tougher to get on board, but Hudson Headwaters, being a federally qualified health center, also has some requirements, which means they have to do outreach as well. So we've brought them on board. We brought in Open Door Mission, which works with our homeless population, which is, unfortunately it grows. And this time of year it'll go a little smaller, but as winter comes and the cold weather, you see it rise again. The White House is our youth program down there for runaway youth or homeless youth. So we have them, and then we actually have Ben Driscoll, who is one of our, our supervisors at the county, but he does it as a community member from Glens Falls. So we have a pretty good representation. So creating the CHIP, I know we just talked about it, but basically you do review a ton of data. For us, we do a bunch of voting based on what the committee members think are the most important. Dee's been a part of that as well, so whether putting stickers on a wall and saying who likes what and doing all that stuff. We come up with our goals and objectives. We identify things that are already out there because we don't want to recreate the wheel. That's always a lot of work. So if there's something already working, where can we improve on that? How can we expand upon that? So we look at those things. And then if there's something out there that's new or different, we try to bring that on board. So when we create the CHIP, it is a process. It's usually 5 or 6 meetings over the course of a year, but the planning starts way before that. It is basically we're into our first year after completing it. We're already starting that data cycle. So I'm part of the data subcommittee. I'm also the co-chair of the ARHN, which then tries to figure out how do we go about doing the next CHA and CHIP. So even though I'm done, I'm not done. Now we're having discussions about how does it look next time. So that continues on. The focus areas, we're no different than Washington County. Our CHIP priority area, obviously, chronic disease prevention. We decided to focus on physical activity, tobacco use, and chronic disease self-management. No surprise there. We have high tobacco use rates. We do have, obviously, a lot of chronic disease. We are actually 65 and older in our county is almost 23%. So, and it tends to increase in the summers and decrease in the winters, but in general, people who consider themselves residents, we have a very high rate. And if we look at the 50 and older population, I must say it's almost 40%. So we really are becoming very top heavy. That pyramid that's supposed to support those at the top is starting to get inverted. So our top is getting very heavy, and our bottom with young people coming back is not growing. So unfortunately, the county is going to have to start to look at ways to incorporate long-term care, but also chronic disease and things like that, because we're going to get folks that are going to need it for a long period of time, and that population is going to continue to grow. It's very hard to see on these sheets. I'll send them to you, but we did, again, we looked at physical activity based on our obesity rates, especially adults with physical disabilities or other disabilities. And basically, we're going to try to get our schools to consider expanding Complete Streets and Safer Routes programs. Glens Falls actually has just signed their Complete Streets agreement with the hospital. They actually have a policy in place now, so they're going to be doing some enhancements there. Warrensburg has signed on as well, so they're going to do some enhancements with their crosswalks. Anybody who's been by Jacob and Tony's, that intersection is one of the worst, and it's one of the main sections for kids walking to and from school. So again, we're looking at that, but we also want to make it safe for individuals to want to be out. We know community movement and involvement is great. So as much as LEQ is nice, having human interaction and feeling safe to do that in your community is even better. And so we would like to hopefully make those downtowns a little more inviting. We've been trying to look at ways to bring in more physical activity programs for our Office for the Aging groups, our senior groups. That's a really difficult one to find instructors to be available to go around to our different groups. I know like the Queensbury Center, they have a ton. They're swimming in resources, where we go to a Johnsburg or a Harkin or something like that. It's hard, and so we're really trying to come up with ideas to how to do that, whether it's grant funding, maybe it's something we can train somebody to do, but we're working on it. We don't really have a great plan at this point because we're just running into a lot of barriers with a lack of resources. So. And then we're trying to do a little bit more with social media campaigns just to promote activity within our communities to get out and move more. We get so used to being indoors now with COVID, trying to get people to come out of their shell a little bit, and explaining being outside is very safe. It's great to, and we have so many parks, we have so many recreation areas. For those who have not been on Warren County's GIS website, if you want to find something to do, go to the recreation mapper. Sarah Frankenfeld has done a phenomenal job. It's got every park, playground, walking trail. They're mapped out. They tell you difficulty levels, parking, directions, anything you want. I can't take any credit for it other than about 3 years before COVID, I came with a basic idea. We had gotten a $1,000 grant to create a brochure. And Sarah goes, I was already thinking about doing that. And so that got her started, and she has taken it off and run with it. So if you want to find ideas for folks, they are great. So if you go to our GIS program, it's called the Recreation Mapper, and it does both summer and winter, but it also includes playgrounds and things, so not just walking trails, but different playgrounds and areas for people to go to be a part of. So if you go into Warren County, I think it's under the Planning Department link, but it's Warren County GIS Recreation Mapper. So that's certainly something. Our second one, tobacco use. Unfortunately, we just got our newest numbers. Our tobacco rates went up. We weren't doing quite so bad, and now we've continually creeped up. So we're back on that as well. I know one of the things that we've started again with AHI, who also holds the Clearing the Air in the Southern Adirondacks, is the topics on tobacco. We just sent a huge letter out to all of our municipal leaders to explain the newest laws that went in during COVID, such as the fact that any place that has a pharmacy now as part of their business can no longer sell tobacco products. So grocery store chains, all those Walmarts, those aren't allowed. The restrictions on vaping, flavored cigarettes, that kind of stuff. So we're trying to do more to raise awareness. We do know that most of our adults are still tobacco users. Most of our youth are now vape users. So we're also looking at ways to limit the number of new vape shops coming up, accessibility. What most local lawmakers don't know is they can actually set policies more strict than the state. The state doesn't have anything about superseding. So if you wanted to, you could actually implement stricter policies at a town, village, city, or even county level. My understanding is Orange County and Westchester both now have a secondary licensing policy. And for every 2 vape shops or smoke and tobacco shops that close, only 1 is allowed to reopen. And so they're doing it through regulations saying, if 2 close, then 1 can open. You can't open 2 for 2. And slowly that will work its way down. So those are things that we're working on with tobacco use. Again, unfortunately ours went up. So using social media, we unfortunately do not have smoking cessation counselors with us. Glens Falls Hospital had Dr. Florio for a while. But we do know that that's a gap in services, and we're trying to figure out ways to get more people trained. Sometimes it's accessibility, sometimes it's cost. You know, the New York State Smokers Quit line is fine, and that can be done online, that can be done through social media, but we do have a lack in terms of resources for professionals to provide. Yeah.
I did, so one of our people online
Mm-hmm.
just wanted to bring forward, and not sure who to bring to their attention, that they have noticed some people have started walking groups. She herself started a walking group, but the only concern was in the winter, they could not find walking areas that anyone in town or the county was able to clear for them.
Yeah.
But they did find a safe walking trail that was Beatar Byway in South Glens Falls. Didn't have one, but
the mall is always open.
Yeah.
The Civic Center has a walking program, the mall does, and they'll open prior to stores opening, so they open their doors for people just to be able to walk.
Okay.
Some of our schools have dual use policies now. I believe like Johnsburg, I think, has opened their schools up too. So contact your schools to see if they have the ability to provide opportunities to walk when it's nasty weather out.
Thank you.
That is something that came from Glens Falls Hospital, believe it or not. They are working on opportunities for expansion in terms of where can we get access. Usually all I have to do is sign up and sign in, and that way they know who's walking and the hours will be there. So I would always check too with your schools to see if they have anything as well.
And the winter snowshoes.
Yep.
Yeah.
There are a lot of those.
But yeah, that makes sense for our older folks.
Yeah.
Or those that require,
The mall's pretty popular. I've been in there
Yeah.
a few times just to see, and it's busy, you know, so.
What's the other one you said, the school?
Civic Center, yeah.
Yeah, the civic centers, school insurance,
As far as I know, they still offer that
Yeah.
now that it's changed,
I think there is a fee.
hands, but it's very small though,
Yeah.
I want to say, but, and the mall is free, it's
Yeah.
just, you just
Like
find the door and go in, so,
Yeah.
yeah.
Thank you.
So that, again, so physical activity, and then chronic disease self-management, we've been trying to work on, trying to find ways to get our community more with a infrastructure, so
I'm
instead
sorry.
of,
Sorry to
Yeah.
interrupt. Did somebody call about an injured deer? The MCON officer is here and wanted to talk to you. Oh, sorry.
No, you're okay. So the chronic disease self-management, we know there's programs available out there. We just want to get people trained to be able to do it. Unfortunately, we are in that area, like I was talking about earlier, we're not sure that we're able to provide that without impacting our state aid. So that's something we're working on. Not only that, but there are a lot of peer-led self-management groups that we would love to see that infrastructure built. So we're trying to find ways, working with AHI, to find funding to bring in those types of trainings to allow those trainings to happen. So it's not just public health, because we are limited as well. We only have myself, one other health educator, we have one more coming on, and that's it. And so to provide those programs in a volume that's going to be worth, a whole lot is very difficult, because we also have all the other programs. So we are working on that as well. And we know that diabetes and heart disease and lower respiratory diseases are all things we're going to have to deal with for quite a while. So.
And Alzheimer's.
And Alzheimer's, yes, absolutely. Alzheimer's, dementia, yeah, absolutely. So the other thing we chose as our second priority was to promote well-being, and prevent mental and substance use disorders. We do work with the association, the Community Services Organization with Rob York. It took me a second to get it out, even though I work with Carrie all the time, to try to put together some plans. I know they're doing some targeted work with our law enforcement to work on responses when it comes to people in distress, and having a measured response instead of an over-the-top response to help with those folks. So they're doing some of that trauma-informed training with our law enforcement and EMS, so when they respond to the scene, there's some of that. We've been trying to work with Warren Washington Association of Mental Health. Unfortunately, they've gone through a little bit of change down there, and so we're not really sure, but what we wanted to try to do was establish a training calendar throughout the years that would provide 4 or 5 different trainings, one on mental health 101, a general training for community members to understand mental health, get rid of the stigma, break down the stigma that's with it. Another one was kind of the psychological first aid piece, which is how do you respond to a trauma. I am trained in it, but I've done that through emergency preparedness as my other role, so it's a slightly different response than just mental health first aid, but we're trying to build those capacities as well. I was working with Josh, I don't know now, so we've kind of hit a wall. We're going to reset and try again, and hopefully we'll be able to bring some more of those trainings on, because they do offer and provide a lot. Obviously, Council for Prevention is in most of our schools. They are providing the Teen Intervenes and a bunch of those things. So we allow them, if they need our help, great, but we just know they're already active, so we just follow up with them and see how things are going. The naloxone program, we've signed on with the RCorp. I think we have over 25 sites now in Warren County that offer, including every Cumberland Farms. Cumbies they went to Stewart's first because they signed on for the needle exchange, or the needle program, where they had the stuff, or the sharps containers in their bathrooms. Stewart's wasn't ready to sign on, so they went to Cumberland Farms, who was more than willing to do it. We've also got them in several of our social services residencies, because there's a lot of overdose within our social services programs at those residents. And then we also have provided them at ACC. They have 4 kits on their site throughout the campus, as well as a few other locations throughout. So I want to say Crandall Library signed on, which is nice. Conifer Park, I believe, now has one just for the public, because they had it, but it was behind the counter kind of thing. But I believe they actually said they would put one out in the front for people who need it. So that's definitely grown. Knock on wood, we didn't see the overdose spike like some of our neighbors did just recently, but it doesn't mean it won't happen, so we're going to continue to monitor that. And then the suicide prevention programs, we just work with Carrie Wright to offer a lot of those programs to help promote those as well. So, and really, again, looking at trying to offer programming for, lost teams that can respond to situations where somebody's had a suicide, and those teams can respond to provide grief counseling and things. Schools have it, but sometimes it's difficult to get people in, so looking to expand on those. Doing workplace trauma-informed trainings, so how do you make a workspace trauma-informed? So we do have some large businesses, and so for them to be aware of how employees are coming in, what their condition is coming in, why they may be the way they are, and to consider those traumas prior to having, any issues, to identify and help those employees. So we want to look at that as well. I think, that's about it. I don't know if there's any questions, but I can leave a couple of copies of the health assessment and improvement plan. I did pass around our actual improvement plan, so that's entirely up to you if you want any more information, and the rest is online. So, and for those, anybody do the community health assessment in here? Anybody responsible for it in either of the counties? Do you guys do the community health assessment in here? Yeah. So did you see the new platform that's coming out? They're going to let you set up dashboards, I think, through each individual county through the CHOD data. I sat in an ISHO meeting last Friday with Janelle, and it's going to be like the graphs and things that we have to create on our own. You're going to be able to do that now. I think with your own county, they're going to do a test run in July, and then I'm hoping by the fall it'll be live so that we can upload it to our own website. Yeah.
I'm sorry, I might have missed it because I was out of the room. For the mental health crisis response, is there any effort to alternative crisis response teams that are alternatives to law enforcement, for people who the present law enforcement might be?
There hasn't been yet, talking with Carrie. I think right now they're very limited in terms of getting participation in general. One is, this is one of the busiest times of the year for law enforcement because of the tourist season and things. 2, getting them to, because they're, like everybody, short-staffed, it's a 2.5-day training, so they're gone for 20 hours. And so for a lot of places, it's tough. They have 3 on the calendar, or at least they're trying to get 3 done. They've completed 1 with 8 folks. EMS similarly, they're very limited in staff, so to pull a group for 2.5 days is very difficult. So one of the barriers they're finding is just time, an issue. And so then participation, but they haven't, I don't think, as far as I know, talking with Terry, they haven't looked into alternatives to law enforcement yet. I did see what Colony, I think it's Colony is doing something really cool with their law enforcement now. You can do you can sign up to say that my child or my husband or my wife or whoever, they have a condition, and you can be on, basically it's a volunteer list, and they can bring it up on the computer. And when they respond, they can see whether or not that person has a condition that would be something that can be triggered. I was watching it this morning on the news, and a woman, did you see that?
Yeah.
I thought it was amazing.
Yeah.
And it seems so easy, so hopefully it expands out. And I believe it was, I think it was Colony that was doing it.
I missed where, so I'm glad that.
Yeah, I think it was Colony, but anyways, so there are lots of those things starting to happen and try to crossing over from, social workers and things into law enforcement, getting to at least understand a little more instead of react. Well, let's come in with a measured response first and then react. All right, thanks.
Thank you. Really good, thank you. So next we have Erica from Hamilton County Public Health on their priority area 1 and 2 initiative.
It's actually not gonna be Erica.
I'm sorry, I'm so
Well,
sorry.
I thought it was gonna
totally
be
good.
Erica, but she didn't wanna do it.
We're totally good.
You're fine. Alrighty. So, a lot of what we have going on in Hamilton County is obviously similar to what we've seen in the previous 2 county presentations, so I don't want to get too in-depth and repeating a lot of the same information. One of the things that I do want to bring up over and over and over is the fact that Hamilton County is very, very unique. And one of the most, I want to say unfortunate, but it's not unfortunate just because it does make us work a little bit harder here in our office, is the fact that a lot of the data that is presented on our county is not always reliable. So when it comes down to looking at some of these things, so for example, if you look at poverty in Hamilton County, if you look at the number of ALICE and poverty households, you see that number is 630. Now, when you compare that to the total population count of 4,454, you go, oh, that doesn't seem like that many. However, we're tasked then with taking that step further and then looking at further data, including the housing stock information. So 630 doesn't seem like a very big number, but then when you look at the total number of houses in Hamilton County, which is about 1,200, you say, oh, wow, okay, so most of the population that is in Hamilton County is in this 630%, and then the other number that, contribute to the total housing stock is all secondary homes. So then when you look at that, you actually get to see the fact that, okay, that 630 is actually reflective of our entire population. So that's something that, it does present a challenge to us, but then it just kind of makes us work a little bit harder and then use our pre-existing talents, experiences, everything like that to kind of make our approach to this assessment a little bit stronger. So in looking at what we have here, so once again, we all know what the priority areas are, everything like that. So just in looking at the community stakeholder survey, for Hamilton County, we had 44 people respond to the survey, which for our county is really, really great, actually, that we were able to get 44 people to do that. But of course, in the next years, we are looking at ways to increase our ability to reach our community stakeholders and make sure that that number continues to rise so that way our data can be even more accurate. And so the New York State prevention, the top areas, of course, were the promotion of well-being and prevention of mental and substance use disorders, and the secondary choice being the prevention of chronic disease. But when you look a little bit further, when you look beyond those 2 main priority areas, of course, you're going to see, the first being mental health, second, substance use disorders, third being senior health, fourth being overweight or obesity, and then the fifth being disability. So once you look at that third benchmark and you see that it's senior health. Now, once again, when you look at the population of Hamilton County, just like a lot of our other counties, it is a senior populated county.
and that number does continue to get older, with the majority of younger residents continuing to leave the county. I think right now the median age in Hamilton County is about 57 to 59 years old, and that number has remained consistent for the past, I want to say probably 5 years. So in looking at that, we're consistently getting older, and we don't have that younger population to come back in, so it's very important that we really find different ways to really target our seniors and make sure that, you know, they are taken care of. And then if we go back through, we do see there are other negative factors contributing, is the lack of mental health services. So of course, we do have Hamilton County Community Services, who is a wonderful team of very highly trained and professional individuals. However, just like a lot of other counties, turnover is something that's very negatively affecting us. I believe as of last year, at one point there were only 2 mental health counselors available, and each of them had a caseload of probably 36 people on it. And so when you have 2 individuals trying to do that, God bless their souls, they did an amazing job, but that's very, very hard. And then once again, once you look at factors such as income, when it comes to paying for those services, especially if they are out of county, that's a major barrier. And so a lot of people, they don't follow up on it. So, and that feeds into poverty. And then the 5th, addiction to nicotine, very similar problems to what everyone is seeing. But the most unique part of Hamilton County is actually the capabilities that we have in our role here in public health. Our role of what we do is so massive. We all wear so many hats, and that's just because we recognize the fact that of our 2 primary care centers, those individuals can only really do so much. We are very fortunate to have our family services coordinator, Margie, who actually came from Nathan Latour Primary Care Center. So she gives us that, you know, unique viewpoint of, you know, what the people in Nathan Latour and Speculator can and can't provide, what they want to and what they physically just aren't able to. So in looking at priority area number 1, we have the prevention of chronic diseases. Focus area 1 is healthy eating and, of course, food security. We want to really increase the access to healthy and affordable foods and beverages, but we also want to make sure that we're increasing those skills and knowledges behind that. We want to make sure that people have the education to actually enforce and drive those habits instead of just telling people you have to do this. You know, we want to make sure that they actually understand why it's important to look at these things. Area number 3 is increasing food security. And then, of course, 4 is promotion of evidence-based education. And then moving into priority area 2, we really just wanted to promote well-being and prevent mental and substance use disorders. That focus area 1 is to strengthen opportunities and well-being and resiliency across lifespans, not just focusing on our seniors, but really taking it that step ahead and focusing on that multi-generational approach. And then, of course, goal area 2 is to facilitate supportive environments that promote respect and dignity for people of all ages. The biggest part, of course, of this mental and substance use disorders is the fact that, you know, we all know that there is that stigma surrounding mental health, and especially in this county, that is relevant. And then when you do have those barriers to care, of course, you know, people are going to tend to lead to more negative coping mechanisms. In Hamilton County itself, both the rate of alcohol-related crashes and the rate of alcohol-related injuries and death are almost quadruple the upstate New York benchmark. So that's a statistic that we looked at as soon as we read our analysis, and it jumped right out to us. So in looking at all of that, now just to kind of talk about our actual interventions. The biggest thing that we are doing and that we recognize, especially in this county, is that you have to meet people where they are. You know, it doesn't matter how great or strong of a program you have. If you're not taking the time to actually get out into your community and meet these people and show them your face and to develop those relationships, the programs aren't going to be successful. Once again, in referencing how we are tasked at going beyond these simple data sets, once you look at factors such as social isolation, you see that Hamilton County, doesn't matter where you look, we're in very, very high rates of just isolation. And a big part of that, of course, is our geography. So in intervention 1, we talked about creating a virtual online platform to educate residents on public health topics. Now, we're very lucky to be taking that one step ahead instead of just relying on that, online website platform or our social media. We're actually in the stages of developing our own Hamilton County Public Health app. So that way we can, come to the same pain as everyone else is when it comes to technology and advance a little bit. But in developing this app that we are hoping to, of course, increase the lines of communication that we have with our community residents. We talked about how the first people that we would use to market this app to would actually be our schools. So that way parents knew that, you could use this as a source of education, references, or if we do need to send out some form of notification, we can get it out there right away and parents can have that. We are looking into, on this app, incorporating virtual cooking classes. So showing people how you can use a budget and then what you can actually physically make with that budget. So for example, Karina here, our public health nurse, she might get up there and say, hey, I'm going to teach you how to make this meal on this budget. And then you're going to break it down and just show them how to do it. We talked about exercise and yoga classes. We are very fortunate that we do have chair yoga classes happening in this room actually every Monday and Friday for our seniors. And those are very, very well attended. And so we are hoping to actually find a way to appeal and reach out to those seniors who might not be able to come all the way up to Indian Lake. So hopefully, if you have this app, you can stream the yoga class right there, and then you can do it from the comfort of your home too. Other than that, we did talk about other things such as gardening and canning information, especially up here, even though our growing season is short, there are a lot of really good potentials for, making your own food. And like I said earlier, we're full of a staff who is very passionate about this stuff. And so we're hoping to share that information. And then, of course, promote our countywide services and programs. So on this app, there would be a section for example, WIC. And then at that point, you can set program reminders. Or you can go onto your phone and you can say, who is eligible for WIC? How do I enroll in WIC? And all of that is right there at your fingertips instead of having to complete 4 or 5 Google searches and then getting frustrated and dissuaded from reaching out for help. So we really want to make sure that this platform is something that we can actually use to educate people and then also help them continue into modern technology. So for example, a lot of our seniors don't really know how Facebook works. So you can sit there and actually set up, this is how you make a Facebook account, or this is how you follow us on Facebook. This is what Facebook can do for you. So really just using that virtual platform as much more of an educational middle ground almost platform. Our second intervention is the enhancement of our presence at our OFA meal site and other community locations by offering regular programming. This is massive. We actually have a lot of different interventions in this area going up. Myself and our family services coordinator actually got to go to a food justice summit a couple months ago, and we were blown away at the activity that they have at their senior meal sites. And we really took that. We decided that we want to run with it. So, for example, we went down to our Wells meal site, and we partnered with the high school because it was Nutrition Month. And so we had the high schoolers in their home ec class come in and actually make the meal, serve it to the seniors, and then sit there, and everyone got to chit-chat, and then we played nutritional Jeopardy. And so the big thing that we learned in that is just increasing that multi-generational appeal. A lot of the high school students actually kind of question, why am I here? And I was like, you can learn something. Go sit down and talk, and you can also teach them something. That's the biggest thing. And it was a lot of fun, and I think the students really enjoyed it. And so we're looking at finding ways to bring that, for example, into Indian Lake. And then beyond that, we really want to just dive into other just multi-generational, as I said, programming, including emergency preparedness. So, for example, right now I'm in the middle of setting up just personal preparedness presentations at our meal sites for our seniors. So having a deputy come in and talk to them a little bit about scams, how to protect yourself from this or what to do in this, and just kind of bringing the information to them while also promoting usage of our meal sites. We also want to do self-defense instruction, and this is something that we're hoping to do not only in the community, but there is a provider in Fulton County named Joe. He works in Azen Latour Hospital, but he also incorporates self-defense with anti-bullying. that way you can actually go into the school and teach these children, this is how you prepare yourself, but these tools are used for safety. They're not used to harm anybody, these are to keep you safe. And so really just find different ways to send that multi-purpose message out. We have our yoga and community-based exercise classes. Eric has been leading an exercise class Tuesday mornings in Hope. As I said before, we have Monday and Friday chair yoga here. Karina leads a walking program here in Indian Lake, and that's been very successful. And Margie leads one down in Wells. I'm hoping to get one started in Speculator. And so, like I said, we're really just getting out into the communities and developing these relationships. And it's funny because you may see the same faces, but it's that wonderful relationship that you're building. You're showing somebody that you care about their health and you want to help them take care of themselves. Other than that, we are looking into chronic disease self-management courses and coaching. We also sat in the same chronic disease self-management program as Washington County did. However, one of our biggest obstacles is that each course needs to have at least 8 people in it. Well, in Hamilton County, you're lucky if you get 2 or 3 people who are interested in it. So when you look at a program such as that, it's cool because we were able to take that education and that learning, but we're actually able to apply it to smaller groups. You know, we're able to go in there and still sit with them, still deliver the same information, and just make sure that they have it at their hands. And like I said before, just build that relationship with them, share that knowledge with them. To us, it doesn't matter if it's 2 people in a group or if it's 8 people. You still show that you needed help, and we're there to help you. We are also finding new creative ways to spread our public health information. So we have been setting up tabling booths at farmers markets, and those have tick kits, lead information, our provider directories. They have a little bit of everything, so that way if you don't know what to do, who to call, boom, you can have our provider directory, you can take our tick kit home, feel free to take COVID tests home, anything like that, just really getting into the community to spread our materials. Then in addition to that, Hamilton County Trailblazers is actually a youth summer recreational program. Originally it was designed as a prevention tool, so of course, us partnering with community services to actually carry out those programming, it's really awesome. I mean, it's really cool to see kids to be so excited about hiking, but then you see them and they don't understand why it's so important to stretch before a hike, or why water is so important, or why sunscreen, or why recognizing the signs of dehydration might be important. And so by partnering with this program, we're able to spread that public health information and still have it be a fun activity for kids. We're also increasing collaboration with other departments that we really haven't thought about collaborating with before. So for example, our Tourism and Economic Development Department, they actually promote different challenges such as the Hamilton County or Adirondack Fire Tower Challenge or Waterfall Challenge. So those are little activities where different fire towers or different waterfalls count as different points. So we're either promoting those or we're using those when we pitch our ideas to these trailblazer groups. Because if you get X amount of points on the waterfall challenge, the kid gets a patch. And I've never seen children be so excited about a patch before in my entire life. So once again, little things like that. And then the final part of that intervention is finding what already works and already exists. So for example, Margie and I were very inspired and fascinated by the snowshoeing idea that we heard at the Food Justice Summit. And so we sat down and we said, wait, there has to be a way to do this in Hamilton County. Oh, wait, there is. So if you go to Pasico School, for example, they have both cross-country skis and snowshoes that are available to community residents. Okay, now where do you take them? Foxy Brown Loop at the Pasico Airport exists, and I believe it's a very brief, I want to say maybe 2-mile loop, but that's historical. Foxy Brown is one of the most well-known characters in Hamilton County history. So it's little things like that. It's combining history with movement with what already exists, and people love to come out and do things like that. So that's of intervention number 2. And then, of course, intervention 3 is the enhancement of opportunities for moms and newborns. This includes the newborn home visiting program, and of course, lactation and peer counseling for breastfeeding mothers. Karina is a certified lactation consultant, and she and Margie have really been just trying to find different ways to increase education on WIC, make sure that women in this county and community know what WIC is and what you can do, really promote a lot of the amazing things that we do, like car seats, bicycle helmets. They're constantly trying to find ways to show that, we're here for the mothers of Hamilton County, and that's so important, especially with us not having a hospital in Hamilton County. When you're in Indian Lake, it can be scary to think that Glens Falls Hospital, an hour away, is the closest thing that you have. But then Margie and Karina are really working hard to show these moms that they are here and they're there to support them and they want what's best for them and, of course, their children. So overall, it's a lot. It's a lot, and we're all wearing different hats, but we're trying to find new ways to appeal to people, and we're just trying to find more meaningful ways to appeal to people rather than just looking at people like they are a statistic or like they're part of a statistic. We really want to make sure that what we're doing is actually benefiting the people of the county, and I think so far we're off to a pretty good start of that. So hopefully we can keep up the good traction, and we're looking forward to the next cycle.
Okay, so what we'll do now is we'll take a moment for Renee to say a quick hello and kind of,
Should I go up there?
you can,
Are you virtual?
yeah, yes, we do have people on, yep.
Be quick, I know it's really late.
I will be brief because I think a lot of you already know me. I think I had an opportunity during COVID. Cynthia had invited me to talk about Choice Connections. So I will be very quick. We are a senior housing consulting and advisory service. It's a small practice, but we cover a lot of counties. We are a free service to families, so we help and support families when they're looking at their long-term care needs. Specifically, we help folks place in market rate housing, assisted living, memory care, enhanced care. We do not do nursing home placement because of the PRI, and it's complicated, and of course, Medicaid as well. So we cover currently Warren, Washington, Saratoga County. We've gone into Hamilton County. We're now going all the way up to Plattsburgh. So that has changed. Clinton, Essex, and also south. We always covered Albany, Schenectady, Rensselaer, and then a little bit south of there. And that happened because over the years, the practice has been around for almost 15 years. Over the years, we've gotten referrals from lots of our professional colleagues, which is where we get most of our referrals, and we wanted to help families. So we spend time in those counties and broadened the number of communities that we work with. Just real quick, we work with adult homes and family-type homes, and again, assisted living and above. We work with now over 100 communities, so quite a lot, and we often can think of places that maybe professionals in those counties don't necessarily know about. So, we can sometimes think out of the box. I would say a lot of the work that we're doing really is for more medically older and more medically frail seniors. Families have waited a long time, and now they're much more frail, and they may need a higher level of care. And we're also, I was just at the Alzheimer's conference in Albany. We're just seeing so many folks that are caregiving, either their parent or their spouse, and really need support and a lot of hand-holding. They were talking at the conference about adult day, the different stages, home care, and then adult day, and then potentially memory care. But we really try to support those families. And for those of you who I've worked with in this room and out there, we're very hands-on. We open the case, we follow it the whole way through. We really provide a lot of support to the family all the way until they move in. And the last two things I want to say about our practice, we are a just two of us. We've both been in the field almost 15 years. We really try to look at people holistically because when you're talking about long-term care, people need many things. So although we do housing, we often may suggest to them that they should start with home care, or that there's not enough resources there to pay for assisted living, that maybe they need to consider community Medicaid and then give them resources for that, or an elder care attorney, or whatever they may need. So we do try to look at them holistically and really provide them with all the support in the world of long-term care that they need, not just necessarily housing.
Awesome.
Thank you.
Thank you. Yes. So, yes, thank you very much for our breakfast brunch.
I couldn't get to the coffee, I'm so
No
sorry.
worries. We were just glad you were here. No worries at all. So I think given the time, we're probably going to go ahead and finish the meeting. Be on the lookout in your emails, everybody. We probably will be sending, we are looking for a little bit of feedback. We recently we were able to partner with Hudson Mohawk AHEC, and we provided a free training, and there will be a second one. We would like a little bit more kind of like off-the-cuff feedback. I know that there was like a questionnaire after, what have you, but really kind of like what things are useful to you specifically around the subject of diversity, equity, inclusion, and belonging. His first one really did kind of bring in the part of leadership and how you, in whatever part you play in the organization and in the community, you are a leader, and and how to kind of implement that. But we also like further feedback on what you're looking for and what your needs are. So you'll be seeing that, and then we will be sending out information about our next quarterly meeting and all the happenings. So please, and also make sure you check in your junk mail, because we do have a new round of people where they're not realizing that they're getting all of this information, but it's going into their junk email and they weren't realizing it for a while. So everybody, it's time to check your junk email again. And I think that's it. So I'm going to go ahead and move to close the meeting. Anybody want to? Second, Renee seconds. All in favor? We're all good. Wonderful. I hope you all have a wonderful day and a wonderful summer. All right. Take care, guys.
Thank you so much. Thank you.
Awesome.